Question 1. Which of the following phases of disaster management includes activities taken to eliminate or reduce the probability and impact of a disaster? A. Response. B. Mitigation. C. Preparedness. A. Recovery. Answer. B. Mitigation. Rationale. Mitigation involves long-term measures designed to reduce the risk and vulnerability to hazards before a disaster strikes, e.g., building reinforced structures or passing safety laws. Question 2. In a mass casualty incident, which patient would receive a red triage tag using the START method? A. An unconscious patient with an open femur fracture and no palpable radial pulse. B. A conscious patient with a closed wrist fracture complaining of severe pain. C. A patient with an open head wound, gasping for breath, and unresponsive. D. A walking wounded patient with minor lacerations and abrasions. Answer. A. Rationale. The simple triage and rapid treatment START method uses a red tag for immediate, life-threatening injuries that are treatable, for example, severe shock or hemorrhage. Patient B is yellow, delayed, patient C is black, expectant, deceased, and patient D is green, minor. Question 3. In drafts, commonly noticed vitamin deficiency is A. Vitamin A, B. Vitamin B, C. Vitamin C, D. Vitamin D. Answer is A. Vitamin A. Question 4. Arrange the following phases of disaster cycle in a logical sequence. A. Disaster impact mitigation rehabilitation response. B. Disaster impact response rehabilitation mitigation. C. Rehabilitation response disaster impact mitigation. D. Response disaster impact rehabilitation mitigation. Answer is B. Disaster impact response rehabilitation mitigation. Question 5. During a disaster, rapidly classifying the injured on the basis of likelihood of their survival with prompt medical intervention is a part of A. Search, rescue and first aid. B. Triage. C. Tagging. D. Disaster mitigation. Answer is B. Triage. Question 6. Most commonly reported disease in the post-disaster period is A. Acute respiratory infections. B. Gastroenteritis. C. Tetanus. D. Malaria. Answer is B. Gastroenteritis. Question 7. As per the most common classification of Triage system that is internationally accepted, the color code that indicates high priority treatment or transfer is A. Black. B. Yellow. C. Red. D. Blue. Answer is C. Red. Question 8. Black color in triage is A. Death. B. Transfer. C. High priority. D. Low priority. Answer is A. Death. Question 9. All vaccines are not given in disaster, except A. Cholera. B. Polio. C. Tetanus. D. Measles. Answer is C. Tetanus. Question 10. True about triage is A. Yellow least priority. B. Red morbidity. C. Green ambulatory. D. Blue ambulatory. Answer is C. Green ambulatory. Question 11. Natural disaster causing maximum deaths. A. Hydrological. B. Meteorological. C. Geological. D. Fires. Answer is A. Hydrological. Question 12. Triage is A. A concept in trauma. B. A method of breast lump diagnosis. C. An investigation for duodenum and pancreas. D. Management of old age health problems. Answer is A. A concept in trauma. Question 13. Epidemics after disaster are caused by all except A. Leptospirosis. B. Rickettsiosis. C. Leishmaniasis. D. Acute respiratory infection. Answer is C. Leishmaniasis. Question 14. The gas responsible for Bhopal gas tragedy was A. Methyl isocyanate. B. Potassium isothiocyanate. C. Sodium isothiocyanate. D. Ethyl isothiocyanate. Answer is C. Sodium isothiocyanate. Question 15. Which epidemic does not occur after a disaster? A. Leptospirosis. B. Leishmaniasis. C. RT. D. Rickettsia. Answer is B. Leishmaniasis. Question 16. Nodal center in case of disaster management. A. PHC. B. Subcenter. C. CHC. D. District. Answer is D. District. Question 17. During massive disaster, what should be done first? A. Search and rescue, first aid. B. Triage. C. Stabilization of victims. D. Hospital treatment and redistribution of patients to hospital if necessary. Answer is A. Search and rescue, first aid. Question 18. In a disaster management triage, patients who need surgery within 24 hours are categorized under which color category? A. Red. B. Green. C. Blue. D. Black. Question 19. In disaster management, all are true except A. Mitigation before a disaster strikes. B. Response in pre-disaster phase. C. Yellow color is for medium priority. D. Gastroenteritis is commonest infection after disaster. Answer is B. Response in pre-disaster phase. Question 20. In disaster management, following are practiced except A. Triage. B. Rehabilitation. C. Mass vaccination. D. Disaster response. Answer is C. Mass vaccination. Question 21. Triage category correctly matched is A. Red deceased, dead. B. Black minor injuries. C. Green immediate intervention needed. D. Yellow stable patient, needs observation. Answer is D. Yellow stable patient, needs observation. Question 22. Triage means A. First come first serve basis. B. Treating person with better prognosis. C. Labeling the death patients. D. Identifying seriously ill who needs treatment first. Answer is D. Identifying seriously ill who needs treatment first. Question 23. In a triage, black color is for A. Immediate resuscitation required. B. Ambulatory patients. C. Unsalvageable. D. Highest priority patients. Answer is C. Unsalvageable. Question 24. During disaster management, the following condition would be classified under International Code green signal. A. High priority treatment. B. Medium priority treatment. C. Ambulatory patient. D. Dead patients. Answer is C. Ambulatory patient. Question 25. The golden hour in emergency and disaster management refers to A. The first 60 minutes after a trauma to receive definitive medical treatment. B. The time it takes for emergency response teams to arrive at the disaster site. C. The first 24 hours of disaster recovery operations. D. The designated time frame to evacuate all victims. Answer A. The first 60 minutes after a trauma to receive definitive medical treatment. Rationale: the golden hour highlights the critical window of time immediately following a traumatic injury when prompt medical and surgical intervention has the highest likelihood of preventing death.